Thank you for joining us tonight for our How Healthy is Your Health Ministry webinar. I am Reverend Carolee Hall, and I'm the West Region Associate Director, and I am joined with my colleagues, Reverend Dr. Alicia Simmons. She's my counterpart in the East Region. Krista is our Associate Director of Healthy Aging. Donna Parks Hill is our Overdose and Tobacco Nicotine Education Coordinator. And then Stephanie Sanders is our Program and Engagement Administrator. So Partners in Health and Wholeness is an initiative of the North Carolina Council of Churches that works to bridge the issues of faith, health, and justice. We want to equip and support faith communities to improve the health and well-being of their congregations and their larger communities. And so we want to partner and support grassroots efforts to challenge injustices. We do this through providing resources, connections, and support to faith communities for their health initiative, and we work to establish trust and partnership with faith communities. And why we do it. So we do it because we believe that all people are loved by God and that God cares about the wholeness of humanity and community's mind, body, and spirit. And so our work is in partnership with faith communities with the hope that they will improve health outcomes of people across the state. So with our focus areas, you can see on the screen, we have several focus areas: mental health, overdose substance use, healthy aging, HIV, physical activity, healthy eating, and tobacco cessation. Most of our work is located within these particular focus areas. So before we get started with the webinar content for tonight, let us take a moment to center ourselves. It's nearing the end of the day, and my guess is many of you have been on the go and busy. So I invite you now to just pause and take a deep breath and let us pray. Holy Spirit, may you fill our hearts and minds and bodies this evening and remind us of our connectedness. Even though we are spread all across the state and are joining together virtually, we know that your Spirit connects us with you and with one another. May we feel that connection to the body of Christ in a real and tangible way this evening, as we seek to build communities of health and wholeness where all can flourish. Grant that we may see things in a new way, to see the ways that you are calling us, equipping us, and sending us to facilitate health and healing and wholeness within our communities of faith. Amen. Now I'd like to turn it over to my colleague, Reverend Dr. Alicia Simmons.
Good evening, and thank you all for joining us this evening. And so if you would pray with me, I will not cough for the next 30 minutes. I'm so excited to see all of you as this year has started. We know that some of you are involved in some amazing work, but the impetus for this particular workshop, I think, was started last year. I had an opportunity to attend a program or to be involved in a certificate program at Wesley Theological Seminary in DC. And as I was going through the coursework to become a health minister, a certified health minister, because I was not serving directly in a health ministry in the local church context, but I get the opportunity and the blessing of working with health ministers across the state, I started to think through how could I aid and assist the people that I work with, the faith leaders that I work with, to make sure that the health ministry that we're providing in our individual context, they are the strongest health ministries that they could be. And so tonight, I'm going to present a presentation that hopefully you will be able to connect with, and I hope that you have something to take notes with. As with all of our presentations, we will send out this recording, as well as any notes or any links that we reference tonight. Also, if you have questions during this time together, please put those in the chat and we will answer them at the conclusion of the presentation. And so Krista Westervelt will join me in a few minutes and talk about the inclusion part of having a healthy health ministry. So, how healthy is your health ministry? Hopefully, you've had an opportunity since the year began, or even at the end of last year, to start thinking through not only the programming that you hope to do, but also thinking through how you'll assess what it is that you have done. And sometimes when we are so busy with all of our assignments, whether, in our congregational context or even in our life, we can get into a rhythm where we just cut and paste from year to year. And we just say, you know what, it worked last year, we're going to do it this year. But this time is an opportunity for us to all reflect on what are the ways in which we could not only look at our programming of not only last year, but previous years, and see how is God speaking to us in this moment that we're in. We all know that since COVID, things have changed in all of our lives. They've changed in all of our congregational contexts, and they've changed in our world. They've changed in healthcare. So, what is it that we need in this particular moment? And so, Healthy Health Ministries conduct annual assessments of its members, congregation, and community. Next slide. And so you're likely saying, well, how do I actually do this, Dr. Simmons? And so here's some assessments we want you to consider. You are meeting with your health ministries, and I know some health ministries may meet quarterly, some may meet monthly. What you can do if you have not already done it is, as you are opening up, maybe you have an icebreaker, or maybe you have a space where people can talk about the concerns that they'd like to discuss. You can see if there are any individual concerns of health ministry members. Now, my prayer, and I'm sure that all of you are providing a safe space with your membership that people can actually share when there might be something going on with them. And sometimes those topics that they share in those meetings that you may have, that may not be public, that may not be broadcast or not be on Zoom, are times when you can say, wow, it seems like a number of people are dealing with this particular issue. Maybe it's likely that we should maybe take that into consideration, or that's something our congregation needs to know more of. And so we know that because we have these national calendars and we have national days of observances, there are some things that will always possibly be on our calendar. So February is Heart Month. And so many churches have invited members to wear red, to wear possibly a little red heart, or to wear a red ribbon to indicate that it's Heart Month. But maybe there's something specific happening in the life of your congregation. And after you've assessed maybe the individual members of your health ministry, you can determine maybe it's an issue we need to be more informed about. The other thing, and we'll share a little bit more information about that, is the Congregational Health Survey. I believe some of you on tonight's program, you are collaborative partners. And if you are a collaborative partner, we have asked you to take a congregational health survey and to get a sample of at least 10% of your congregation. With the congregational health survey, what it does is it allows you to look at the data and to assess where are the needs in your congregation. And as Carolee said, she works on the West, I work on the East, but the Congregational Health Survey, if you have completed one of those in your congregation, we can take that data when it's done electronically, and we can have a conversation with you, a consultation, to see where there may be concerns of programs and interests, that there are things that maybe you need to bring to the congregation's attention. In the past, we've had some people who wanted to do the congregational health survey, but because of some digital divide issues, people have been concerned that people would not fill them out, so they wanted the hard copies. Stephanie, who's not with us tonight, can provide you a PDF, and you can do that internally. However, we won't have the capabilities to capture the data in a spreadsheet where we can do the analysis for you. But that's one of the ways that we are encouraging you tonight to really check on the health of your health ministry. Sometimes people will not be forthcoming with faith leaders, but sometimes pastors might know what's happening in the congregation. But as the health ministry, You may not know about all of the maladies, the conditions, or the interests, but when you do the survey, then you can do a broad survey of what is happening and then take the data and say, wow, I didn't know that so many people in the congregation may be dealing with this issue, or there might be this need, and this is something that we could possibly address. The other thing that might be helpful for you, and this is something I learned about when I was in the health minister program, and my colleague Donna Hill, Donna Parks, who comes from the public health sector, was aware of it because she had to participate in it. Is there is a community health assessment that's done for every county, okay? And so the last community health assessment that some of you might find for your counties was done in the midst of COVID. And about 2 weeks ago, I was at the Johnston County Health Department, and they are in the process of putting and compiling that data. With the community health assessment, you have a number of stakeholders, the health department, the healthcare systems, physicians, social workers, and a number of parties required by the government, essentially, to come together to determine what are the needs of a specific county. And so each county will have their own community health assessment. And when you are unsure about what are the topics or the programs or the things that you should be addressing in your county, you can look to your community health assessment. The easiest way I can tell you to access that information is to put in Google, okay, community health assessment, comma, in your county. And what you'll notice is you will get the document. Sometimes it's on the website of the local health department. It may be on the website of the hospital system, but you will find the community health assessment. So it gives you a broader view of what is specifically needing to be addressed in your community. And so Caroline's going to click on the North Carolina Social Determinants of Health by Regions. And this is also something, so the community health assessment is going to give you lots of words. It's going to give you an analysis. And so with this tool, and we'll include the link when you get this PowerPoint, it tells you specifically, as you look at what region you occupy in the state, what are some of the issues and the concerns and the challenges that might be faced in your community. And so as she scrolls through, you see it provides a story map, and it also provides some census data. So you can look at some of the things that we look at, and as it relates to physical wellness and mental health and all of the things that you may be trying to address in your health ministries. Okay. And so some of the information may be useful for your health ministry. And it's possible that even beyond your health ministry, the congregation may be better informed of what is happening environmentally, socially, within the midst of your community. Okay. Thank you, Carolee. And so here's just an example of the PHW Health Survey. It's the form that we use, the format of the form that we use, and you can click to the next slide. And these are just some of the examples of the questions that it captures, so that you can determine, maybe you have thought, well, everybody in our congregation, they're healthy, they eat well. And then you might do the survey and find that there might be some type of food insecurity in your own congregation, and start to think through, then how do we address that particular need? Because maybe we've been addressing it externally, but maybe it's something we need to think about more internally. Next slide. And so, as I said, if you would like for us to assist you with capturing the data with through the survey, we want to make sure that you're all members of our collaborative, the PHW Collaborative. Many of you are already members. And so we can help you analyze the results of your PHW Health Survey as collaborative members. Remember, that is one of the membership benefits of being a part of the collaborative. And it's likely that maybe you have not taken the health survey last year, or maybe the year before. Maybe you got involved with PHW 3 years ago and you have updated your collaborative, or maybe you haven't. But if you want to use that tool, we encourage you to become a part of the collaborative. And then what will happen after you have allowed, let us know that you're capturing the data, or if you've given out the link and you've gotten everybody or whoever you're expecting to complete the survey, we can then set up a meeting time to talk with you about what our findings are, and of course give you the data so that you can work internally to figure out how can you enhance your health ministry programming. Thank you. Next slide. And so this is how you get to the PHW Collaborative. If for some reason you're not sure if your collaborative pledge is active, you can email PHW info, and Stephanie will verify if you have an active collaborative at the time. And as I said, if you feel that you can't capture it digitally or electronically, it's harder for us to do the assessment because you'll have handouts and a lot of data that we can't then calculate. But if you do it electronically through the form that we and through the link we provided, then we can do the assessment. Next slide. And so that is just the QR code. If you would like to do the survey, we could send you the QR code that you could put on the back of your programs if you still have bulletins that are printed in the morning worship, or you can put it on the screen, or however you choose to distribute the survey to members of your congregations. All right. And so this is just a sample of the community health assessment I talked about earlier. This when I pulled up the data for Johnston County, because I was at the public health department, this talks about the significant health needs for Johnston County. Now, some of the topics on this list aren't necessarily in the focus areas of PHW. However, with your health ministries, you can choose to work beyond the topic areas that we cover. We cover, of course, based on our program and how it was written. However, there are a number of things that are considered health needs, but we don't necessarily often think about them as health needs. For example, transportation and people's inability to get to doctor's appointments or to get to treatment or to get to something that they need for their health care. That might be something that your health ministry hasn't really thought about as a health need, but it is. And so you see that they list a number of items. And so when you go to your individual health assessment for your county, you will see similar lists, and you can begin to think through then how can we respond. And some of those issues, for example, adult smoking, my colleague Donna, she can connect you with a workshop or can connect you with some assistance to provide maybe information to your congregation about that. Next slide. So here are some things I want to put forth, okay? And I want you to start thinking about your individual context. So as I go through the next few slides, I want you to think about the current work that you're doing, okay? Do assessments and community needs suggest new or updated programming is needed and would be welcomed by the congregation? And I think sometimes people are somewhat fearful of asking people's opinions, because what you might get is a counter opinion. Like you might get someone telling you that what it is that you're currently doing might be nice, it might be good, but may not be as effective as you believe. And I know we're all very sensitive about the work that we do. Whether you're a pastor, I've been a pastor, and I plan something, I want everybody to co-sign on it. But maybe what it is that you've put forth, it might be good, but it might not be the best way in which to use the time or the energy of the congregation or the committee. And so sometimes assessments and taking into getting the opinions of others about the work that we're doing, it'll help us better do what it is that we set out to do. And so even in PHW, we have to always give back to our funders what it is that we're doing and look at its effectiveness to see, one, have we done what we said we're going to do? And are we being very effective? What are the outcomes? They want to know the outcomes. What is happening? Next slide. So one of the challenges I know sometimes you might face in your health ministries, as well as in a number of ministries across the scope of the parish or the church, is this mindset, no matter what denomination you're in, of we've always done it this way. And so Healthy Health Ministries consider what could possibly be innovative. Okay. And sometimes innovative is not just connected to technology, but it's new ways of imagining. It's new ways, or it's even sometimes new topics, or even taking on things that may be controversial in nature. Okay. And so just because we've always done it this way, is it always the best way for us to do it? And so I want you to think through, and maybe you're jotting down some notes. How many projects or programs exist on your schedule because it's just a part of the annual calendar? It's just a part of the annual calendar. Every year, we're just going to wear pink in October, and that's what we're going to do. We're going to give everybody a flyer, and that's going to be how we observe Breast Cancer Awareness Month. And so if you step back and think about, and it's important to observe Breast Cancer Awareness Month. If you read our newsletters, you probably are aware that I wrote in one of our recent newsletters about the death of my sister due to breast cancer. So I'm not trying to trivialize or downplay the importance of breast cancer or breast health awareness in any way. But how else can you bring attention to a matter or an issue that's on the calendar? You're going to do it, but instead of doing it the same way, how could you reimagine and re-envision observing or bringing the congregation's attention to a matter? And so as you think through this tonight, I want you to think through maybe a conversation you may have to have with your committee, a conversation you might need to have with your faith leader, or a conversation you might even need to have with yourself, because you might say, you know what, we're doing my program. We do my programs every year, but we have to really think through, if we're going to have the healthiest health ministry possible, is this the most effective way to talk about this, to bring the attention to focus on this? Do we need to do the same health fair? Or is there a possibility that maybe there's one component of the health fair or one component of a previous program that we now need to amplify or we now need to build upon? Because based on our assessments, we see that that is where people are really being helped, or they're really starting to think through some aspect of their health, or they're really being activated to go get additional assistance or treatment. Next slide. And so we internally with PHW, for the last 2 years, I've been here for about a year and a half, we've been reassessing our existing metrics. Okay. How are we measuring what it is we say we're going to do? Okay. So we have funders. And so before I even got here, our new PHW existed. Someone sat down and told our funders, we are going to do A, B, C, D, E, F, G. And our funders are expecting us to come back and tell them what it is that we've done and how well we've done it. And we do that by getting data and information from you. And so that's why we're always asking you to do our surveys. We're asking you for feedback about your programming, the attendance, how people were served, the reach, the impact, because we're always analyzing and rethinking our existing metrics. And it's possible that as you build your health ministries, you have to consider, what am I counting? Okay. Are we just counting people? Am I just counting the effectiveness of my program by how many people show up to the health fair? Or is there another metric that we can use that will be useful as we go forward to build this program? So, how are you measuring what you are doing? Okay. So, we ask you that from time to time. And some people say, well, we're just going to count people and we're going to just ask people if they feel better. Or we're just going to see if more people come and participate. But these existing metrics that we're using, maybe they don't tell the story that that needs to be told. Okay. So, in graduate school, you have to do a thesis, you have to operationalize your variables, you have to write the hypothesis, and then you have to tell the scholars, your professors, how am I going to get to these results? What am I going to do? How am I going to collect my data? How am I going to analyze my data? And so those are the metrics we're talking about. And so how can you move beyond attendance numbers to better gauge participation? Not only did people attend, but as you start thinking through your programs, make sure that you're providing a survey tool that really assesses not only that they attended, but how is it that they benefited from the program that they participated in. In some cases, it could be a longer survey tool where maybe if they're coming back from week to week, that every week you're trying to gauge or analyze something different so that you can build a case and tell your story at the conclusion of your program. And the other metric that we hope that you are gauging or you will think through is, are more people from the larger community attending? Okay. And so as we work with congregations, we know that some of the program is specifically for the congregation, the people on the pews. And then there are programs that you hope that you will expand so that you can get some engagement in the larger community. And at the core, that is what PHW is all about, establishing partnerships. And are you measuring the connections made between community partners and other congregations? Are you seeking to do that? One, and then after you've sought to do that, then you can begin to measure. Excuse me for a second. And so as I was putting together the presentation, I thought about a pastor who is in the east. I mean, it was a ride for me to get there. And so she sent me a picture and an email a couple months ago because she was building connections and she was making partners in the state with organizations in the state. And she says it started because her work with PHW. When she came to our Faith and Health Summit, she learned about a program. She got involved in that program. And as she got involved in that program, then she was invited into another program. And what she began to do is build capacity for the programming she is now doing, because she began to develop community partners beyond PHW. And so that's our goal when we bring to you the different webinars and the different speakers, is for you to build capacity of your program. So while it may have started as one program, you begin to have support from a number of different voices and a number of different resources in the community. Next slide. And I think this is a repeat question, but sustainability. One of the things that is our goal with PHW, and we are being tasked with, is how are the programs that we are working with, the churches we're working with, is your programming become sustainable? Meaning, we know that a number of you over the course of the last couple of years have received funding from PHW in a mini grant. Well, now we're starting to look at, are those programs being sustainable beyond the mini grant? And so how do you make programs sustainable? You make them healthy and you build capacity for them, and you make sure that people in the larger community are attending. Okay. And are you measuring the connections made, as I said, between partners and other congregations? Next slide, Carolee. The other way to measure sustainability is, has your project or program become a model for programs in your community or denomination? And so there is another pastor we are working with in Durham, and we are excited about the project that they are working on, because what it is they're building a model that they're hoping that they can share with their denominational leaders, so that the program that they're working on in their congregation won't just serve their congregation. It will then be something that they can take to the denomination, and it can be shared out with all of the churches under in the how are they structured, within the district of the denomination. And so sustainability means that you're not just planning something that's going to sustain itself in your church, but it has the ability to flourish and grow beyond where it was started. The other thing, as it relates to the health of a health ministry, is have you secured additional partners and funding beyond PHW grants? And so, as I mentioned, additional partners may be partners maybe with the health department, or partners with DHHS, or partners with other nonprofits in the area. When I went to Johnston County and I met with their faith network, I met with not only faith leaders, but other nonprofits and organizations in the community, because sometimes there are groups in the community that want to do the programming that you're able to do. However, they don't have the people who are just sitting there in the pews to do it with. And so having partnerships beyond the congregation are very helpful, because this also assists with sustainability and some of the resources that or external. For example, the extension services and the health departments, they often have access to grant funding and to some resources that we may not have access to. And by building coalitions with them, then they can help you broaden the scope of your program, which allows it to be a healthier program. Okay. The other thing, as it relates to sustainability, and if you could go back one, is has your congregation designated more funding support your programs, because there is evidence of success. And so from week to week, we hear back from a congregation and they're talking about the success of a program where some effort might have started with 5 people coming regularly. Now they're up to 15 people. Now they're up to people wanting to know, can they do a particular effort or a program even more? And so when that begins to happen, that's where the health ministry, in working in partnership with your your church leaders, because I know that you can't make a lot of decisions on your own, but you start to begin to have a conversation about the impact, about the work that you're doing. And so I understand that all congregations and parishes may have different approaches to the budgeting process, but I think it's important that as you collect your own data, then you can actually make a better case as it relates to how what it is that you are doing in your health ministry. It is beneficial to the congregation. It's beneficial to the larger community, and because of its benefits, then there may need to be more funding allocated for it. And I know that can be a very difficult conversation, because I've sat through those conversations as pastor as well as a lay member. And so as you collect data, the data helps you to be able to tell your story. And the data helps you to be able to not tell your story, but to let people know that you're doing work that is very essential and important, and that work does need to be funded. Next slide. And so I think this is a repeat, as except the last question. One of the ways in which you know that you have a healthy health ministry is that health and wellness is embraced holistically within the congregation because of your work. And it's not just something that's a one and done kind of situation where you're just observing the days when you observe things, Heart Month or breast cancer awareness or pancreatic cancer or something related to children, but it becomes a part of the life of the community. And so when you signed your collaborative pledge, there are a couple of things within the collaborative pledge. It talks about including more water and drink, for communal meals, and trying to make your campus a smoke-free campus. Those are things that suggest that health and wellness are taken into consideration as you do your work. And so I was talking with a group the other day, and I said, I know one of the contentions some congregations might have, especially those who are focusing on healthy eating, is when it comes time to plan possibly communal meals. And so we joked and we laughed. And I said, we have to begin to think that not only is an option baked chicken nowadays, but how many plant-based meals or plant-based options are we offering people when we have communal meals? And someone said, yeah, because I don't want to eat meat all the time. And so as people are changing the way in which they eat for personal reasons or for health, those are the ways in which we, as the health ministers in our congregation, can try to begin to have conversations that might be difficult. because I've kind of had a knockout, drag out fight. I was telling them about when I was in divinity school at Duke and I was an intern, and I was talking with the kitchen committee about, how I wanted the meals for the children I was working with, how I wanted them to think, through I wanted fruits and vegetables and yogurts. And it was a very interesting internship experience. But I began to see that sometimes, even though it's easier said than done, but that conversation led to another conversation, which led to a beautiful experience of helping the congregation think through how do we incorporate this whole aspect of health and wellness throughout the life of the church. And I'm happy to say that church is now doing some amazing work. They received the BIPOC grant for mental health. They're doing amazing health and wellness work. And so I'm glad that I could help plant a seed in the eating area some, I don't know, 10, 13 years ago. And now health and wellness is very much a holistic part of the life of the congregation. So it's not an afterthought. It's not like, oh, we got iced tea. Oh, yeah, we got to get some water. But people are already thinking about how are we ensuring that when we come into this place of worship and when we fellowship, we're making sure that people have options that are healthy and that may accommodate them. All right. Thank you. Next slide. And so I'm going to pass the conversation on to Krista. Krista works with our healthy aging area of PHW. Healthy ministries are inclusive. And so Krista's going to help us better understand how, as you're doing your work, to think through not just are the needs of everyone being addressed when we sit down for a meal, but how are we making sure that everyone is allowed to participate in the work that we're doing? Krista?
Thanks, Arlisha. So yes, healthy ministries are inclusive, and as Arlisha mentioned kind of earlier in her portion of this presentation, if nothing else, COVID has really shown us where our interdependence lies. And so the whole point of this portion is to kind of lean into that. One way we can kind of look at that is to look at some of our priorities and commitments that we can consider as we're doing our health ministry work. Is our work meaningful? Is it doing work to prevent issues coming up later on? So that might be chronic illness. It might be preventing loss of function. Are they inclusive? And we'll talk about the elements of inclusivity here. Are they intergenerational in solidarity and scope? Now, I do focus on healthy aging, but we don't arrive in older age just out of nowhere. We are affected by what goes on across our lifespan. That was some of what we saw with the link for the social determinants of health. These are considerations that working with both younger folks in the congregation, children, youth, younger adults, middle-aged folks, all the way up to our older adults. Having an intergenerational scope for programming is both great for having better health outcomes across the lifespan, but also helpful for sustainability as we're doing this programming. Is it covenantal? Are we thinking about our obligations to one another as we're doing this work? Thinking about what our responsibilities are as we engage in this, what participants' rights are when they participate. How are we in covenant with one another as we do this work? And is it participatory and empowering? Are we just deciding for folks what we think that they need, or are we hearing from folks what they need? And so oftentimes if people are participatory in what's going on within a health ministry, if they know what they need, then they're more likely to engage with that work. And again, another option for sustainability. So some of the elements of inclusivity, and I include these in the Healthy Aging Inclusion Plan, but they apply across the spectrum, are these elements of emotional, environmental, intellectual, and cognitive, physical, professional and vocational, social, spiritual, and economic. And these are all things that to sort of consider as you're developing your health ministries, and not just developing, but sustaining them. So is the work that you're doing holding space for the varied emotional lives and mental health needs of those within your congregation? And some people might not be open with you about what those are, but just try to get an idea of what that might look like, what maybe some of the ongoing emotional needs are within your community, and think about how those might affect whole person health, whether that can include people who are grieving and how grief might affect health, other mental health needs as well. Environmental, like what's the setup of the physical environment of where you might be doing your meetings or your health ministry work? Is that accessible to folks? People with disabilities, can they access that environment? If people might be of a fall risk, are you making sure that you're preventing falls? You have railings where there need to be, those sorts of things. And so making sure that your environment is accessible to folks is an important part of inclusivity in terms of your health ministry. If people can't safely navigate the space, you're missing out on helping some folks. Looking out for intellectual and cognitive inclusivity. And so that's just keeping an eye on just noting what the varied intellectual and cognitive abilities are of those within the community that you're serving, whether that's your faith community or the broader community. Are you tailoring your programming to support people who might be experiencing some cognitive deficits? Are you making sure your information can reach folks at different intellectual abilities? Anything that you do around that's especially helpful. In terms of physical inclusivity, this is partly the preventative work, making sure you have modifications. If you have an exercise program, don't assume everybody can stand or run. Make sure you have chair exercise programs offered, those sorts of things. A focus on function rather than aesthetics. I mean, I know one of the things that we showed earlier that was from a county report on needs. I think sometimes there's a focus on weight. And we would recommend ultimately a focus on health and function. So that might be, rather than deciding, okay, we're going to measure how much weight someone's lost, let's lean into how's their blood pressure? How are they controlling blood sugar if they've had issues with diabetes? How are they improving function in different ways? So that might be around balance and coordination. That might be around being able to go for walk a little further during the day, maybe go upstairs with less getting out of breath. Looking at different functional ways that we are being inclusive, that also maintains some sustainability within our programming when we do these sort of inclusive ways where we're not focusing on someone's aesthetics, but on helping them maintain and improve their physical function. In terms of professional and vocational, that might seem strange to talk about within the context of a health ministry, but a lot of that's just offering up ways of looking at people's assets across, and I don't mean money, across the scope of their lives. What kind of meaningful ways can people interact with the health ministry as a form of vocation? So that might be, how can they plug in as a volunteer? How can they have a voice within that work? Social aspect of inclusivity. While we're doing all this health ministry work, we can also look at the fact that part of health is our social interconnection. And so what are some ways that health ministry is not just about looking at specific parts of health, but how is it also bringing us together to help counteract social isolation? There's a spiritual component, which I think building that spiritual component of inclusivity in can also help with the sustainability and the whys around the work that we're doing. So we understand that this is a connection of the spiritual and the physical in a way that's honoring our whole person and our whole being in the image of God. And then economic is making sure that it's economically accessible to whoever you're serving, being aware of sources in the community that you can make referrals to if people need them. And another way to make it economically inclusive is, again, it's also a sustainability situation where learn where you can plug in, reach out to us. We can help you find resources to plug in to keep the costs down for your congregation, because we know that we're not all rolled in dough here. We want to make sure we can plug you in And so having an economic inclusivity to your health ministries will help with sustainability, and we're happy to help you there in that.
Thank you, Krista.
Yes, thank you. And just one other thing I would say is, like, as you're kind of looking at the work that you're doing and kind of sussing out, like, how are we being inclusive in these different ways? I encourage you to look at what your assets are rather than looking at it like, oh, we're not doing this and this is a deficit. But like, just dig in. Like, who do we have in the congregation who has this expertise or knows this person or networks? More often than not, if you start scratching the surface under the surface, you will find that you have a lot of assets already there to make this work. And again, we're here for you if you have any questions around this information to help you to build this.
And as Krista talked about assets, let's say you decide to revise the health survey. Maybe that's something you also assess, asking people what assets do they know about, or if they have recommendations. And you can even do that from time to time, in some way in your congregation of, saying what it is that you need. And maybe someone can point you to an asset because they've had an experience with one, or they know of someone, and that's very important to consider. One of the things that I failed to mention during my presentation is privacy. And healthy health communities always make sure that they are protecting the privacy of the people they're serving. I think that conversation hopefully is a part of your conversations when you have your meetings. But think through, are we being inclusive and making sure that people feel comfortable coming to our program, especially when it's something maybe that might be controversial, or there might still be stigma attached to, especially programs like mental health. So in some instances, there may be you may need to do an extra attempt to make sure that people feel safe and secure when they're in some settings. So you might have a mental health program, and maybe you don't do a sign-in sheet per se, or maybe you have people register just individually with cards that you collect if you need to collect their name or information. So just thinking through ways in which people, as they access the services, the resources that you provide through the health ministry, they always feel like it's a safe space. And sad to say, sometimes people come into our worship services or into programs that we do, it may not always feel like they're not going to be harmed. So if, as the health leader, you can think through that, especially when it's something, or even if you decide to have a conversation about domestic abuse or partner violence or something that's, in our wheelhouse, always make sure that people will be protected. Think through media, think through recording, think through those things that could put someone in danger, who might feel uncomfortable or vulnerable in that space. Okay. And so we've done a
Yeah.
lot of talking tonight.
I just want
Krista,
to
you have
add one
something to
thing.
add?
Yeah, I just want to add one thing to that too, is that along that same vein, along these things that are stigmatized, make sure that 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 message that people are welcome or safe isn't just siloed to your health ministry and not the broader message of your entire faith community. So if they're hearing something different from the pulpit or from this Bible study or this that doesn't match that same destigmatizing message, people are going to feel less safe. So like this really has to be a holistic effort. Just something to consider. The other thing too, I just wanted to mention briefly around accessibility again is like helping with transportation. And also make sure you're varying the time of day that things are at. Some people can't drive at night, for instance. And so make sure that things are accessible in that ways. But yeah, thanks, Arlisha.
Ooh, I got some more to say, but we're going to open up the floor for Q&A. Thank you, Krista, for bringing up the portion about being intergenerational. That's something we also want you to start thinking through as we have been working with churches. We often find that there are a lot of programs for one segment of the community, and some churches may reflect one population or not another, but I think all of us always, remind people to think about the children, think about the next generation, and how to make sure that, as Krista said, we don't just all show up and we're, AARP members. It took a while to get there. So making sure that you're thinking through that as you do your programming. Are there any questions you have? Okay. That you have for us if you want to come off of mute and ask those questions, or maybe things that you'd like to briefly share with us as we've talked about the health of your health ministry.
Hi, this is Peggy from Southport, North Carolina. We have a nursing health and wellness group with 6 nurses. I think there are 6, and retired, but 2 of them still have their certification. And we're reaching out to the community, and we're also doing a program on aging in March. And I mentioned mental health. We have 2 grief groups that are private. The problem, I think, with some of like our other classes we have, when people talk about people being sick, or it seems like there's not too much HIPAA because they're talking about other people. I think they agree to that, the people that are, when they make the announcements. But it's hard for our group to kind of try to keep things confidential when it's getting out in the greater community. So I don't know if do you have nursing groups? I didn't hear anything about nursing
Nursing groups per se, I think
in
that
your
might
congregations. Yeah.
and we would have to poll individual congregations, because some health ministries are set up where it may be all health professionals. Some are set up by lay people with 1 or 2 health professionals. So every congregation is uniquely kind of made up, but that's something we can take into consideration as it relates to possible other training of talking with groups about HIPAA and privacy. And about HIPAA as a nurse, but if you're a layperson, you may not be as familiar, as well as some clergy don't understand, even though, not everybody's, fully aware of privacy issues. So that might be something that we can address in another context, or in providing more communication.
And we're kind of on call, every week or 2 weeks. We just started in I think it was the summer, last summer. And so it's gradually happening, getting to know who we are. And then we went to a program on Alzheimer's with another community area that provided that in Southport. And then the aging thing. And then we're thinking about maybe having like a fair to educate them more about. I like your health and wellness stuff. That's really important.
And we may be in contact with you at a later time, Peggy, to help us as we think through that item. But thank you for that. And so I think, I'm glad you brought that up. You have private groups. And so sometimes we think, we're going to have a larger group, or we're going to talk about it in a large setting. About a year or 2 ago, as we were thinking through and working through the BIPOC mental health grant, we talked with a consultant from a church in DC, and she talked about, there are times when, as you do your announcements about certain programs, especially if it's about mental health or domestic, partner violence, don't advertise where it's going to be. Let people sign up. And then as they sign up, you tell them where it's going to be, and then make that a protected space. And so it's little small things that, ministries can do to make sure that people are safe. So you might not have that particular conversation in the larger fellowship hall. Maybe you have a smaller room, or maybe, the church has resources to make it an off-site activity, so people will feel safe, especially when they're sharing information that could put them in harm's way.
Yeah, and one of the things too, and that's part of that, kind of goes back to that covenantal aspect of inclusivity. It's like, can you create some covenants and some guidelines together around how you will share these different information and how the information will be safe? So it's creating covenant around that and some agreements there, which really helps. Yeah. I think Audrey has a question.
Hello, good evening, everyone. I am from Kinston, North Carolina. My church is Smith Chapel Free Will Baptist Church. And I'm just glad that you mentioned the issue of privacy and participant safety, because sometimes I find that our participants are reluctant to really share their situations because of the small communities in which they live, and they just don't want others to know about, their business. So that has been and probably will continue to be a challenge for our church. I'm not sure how to make people feel comfortable about being honest and sharing their true circumstances. So I guess I just need some help and some guidance with, trying to make people uh eh, tell their true business to us so that we can actually help them.
Audrey, I think I am in you're in my region, and I'll follow up with you with a phone call. And as Krista said, there might be a number of things that need to be considered. It could be the space you're meeting in. It could be, just a number of dynamics, but we would have to talk through what the culture, of the church is and of the room and of the meeting, and think through what are some ways in which you could better make that experience better. We can also talk about the covenantal agreements. And so some of you might be aware of, you've been in groups or you've been a part of fellowships where at the start of the program, you determine, here are the things that we agree to do. Okay, we agree that what we say here, won't leave out of this room. And so as Peggy stated, as a nurse and as a medical professional, she is fully aware of HIPAA, which is a federal rules. But church people don't always know that. But there might be, you have to have that conversation. And it may even be something, in some cases, I've heard, the pastor has to say, we invite people and we want people. And so, you may have to talk with your faith leaders, because they will have to make sure that people understand that if you participate, this is not something that you're going to be further violated by attending. And so that determines a lot of things, and that, factors into the culture of the congregation. And some of the things that you can't change, because the nature of a thing is the nature of a thing. But we can talk about how to make sure that you can do as much as possible on your end to make people feel comfortable, and to establish trust. We know that establishing trust is a long game. And so, the first time you come and you share all my business about whatever's going on in my body, I'm never coming back. So it may take some relationship building.
Okay, thank you.
And I have your information. I'll reach out to you.
Thank you.
Yeah, for sure. We've had, like at the church that I'm at, the lay ministry team will know what's going on with folks, but without their specific permission, that's not brought up during prayer request time at church, those sorts of things. And so it's like, we know if you're in this group and you bring this up, Sister Martha's not going to go hang out with her friends tomorrow and like, oh, here's the prayer request because she heard about your business at this other thing. It's just this whole, how can we be covenantal about where the information is shared and who needs to know and all of that. So, yeah.
And are there any other comments? It may not be a question, but maybe just a comment or something that you are wanting to give us feedback on as it relates to what we've discussed tonight.
Hi, this is my first time attending. I did drop a note in the chat. I am really just so grateful to be here. Sister Alicia, thank you so much. Krista, the information that you shared has been great. I hope to take this back to my congregation. I am new in the position of Health and Wellness Ministry Chair, and I have been thinking about out of the box things that will take us away from those national health days. So I feel so confirmed just hearing what you said tonight. I want to bring things like, breathing therapist and, drum circles and just, things that are just not the norm, And I'm just a little apprehensive because I'm not sure how it'll be received. The whole thing about the plant-based eating, I was over here just doing a quick little shout and amen because the fried chicken and the butter and buttery potatoes and everything from sustainability, from the way it's sourced, how it's cooked, and what we're serving it on. We could be environmentally sound while we're doing some of this work as well. So I'm really grateful. I hope the recording will be shared. That's kind of one of my questions. I heard you say the PowerPoint will be.
The recording will be shared.
Oh, very good. Perfect. Because some
Mhm.
of my counterparts, I would love for them to hear this conversation. But I thank you. I'm grateful. And I hope I'll be able to join you all again. If there's a email list, please put me on it.
Well, if you register for the night, you will get all of our emails. And so
Okay.
Stephanie will compile all of this. We'll probably make some corrections to the PowerPoint and send all of that out within the next couple of days. Thank you all so much for joining us. Now, we know that Rome was not built in a day. Edgecombe County, Ms. Morris, I am your regional. If Donna could put my email address in the chat for Ms. Morris. So Edgecombe County, I'm in the east, and so I'm your contact person. I am willing to have a conversation with you, and if time permits, even though we have had this conversation, and depending on, we try to do most of our work during the day, but if for some reason you want us to zoom into your health ministry meeting at some point in time, just give us adequate notice and we'll see if we can do that. If you have Zoom capabilities, if you kind of need us to kind of help you as a collective health ministry, talk through something that you're working on. And so, Francine, thank you for sharing your interest in trying to expand your health ministry. One of the things that I would encourage you to do is to be prayerful about it, but also to think about the theology of the context in which you are in. And so you talked about drum circles, so that means a cultural component. So, talk with your faith leader and be prepared to have those conversations because sometimes people aren't able to make the cultural and the theological connections all together because we've always done it this way. And sometimes
Absolutely.
that does not take into consideration some of the culture of certain communities, especially if you're a Black or brown person. There are some things that we may not embrace, but they're part of our African diasporic experience. But it takes just having conversations and building that trust and not trying to change everything tomorrow, but gradually over time, talking with your leadership to let them know that you're trying to make the experience a more holistic experience for all who are involved. Okay.
Yeah, and I know we're wrapping up. I would just add too, like if it starts to get overwhelming, just find your way back to the why that centers all of it. You've got this, and we're here for you.
Gail, you asked about Johnston County. I'm not sure what that specific ask was for, but the person, there is someone who they have a faith health network at Johnston County Health Department. I'll take your name down and I'll try to send that to you tomorrow. Someone mentioned the extension service. And so that's the extension services across the state. They are amazing. And we often refer people to the extension services as well as to the health department. Someone sent a message about the collaborative grant application renewal process. We are currently not in a grant cycle, so there is no grant application to be submitted during this time. If we have any grant cycles that are opening, we'll share that via email and we'll send that out to you, especially if you're a collaborative partner. Okay. Thank you so much. At this time, I'm going to invite Donna to provide our parting words. And so Donna, can you tell them a little bit about what it is that you do as we end this evening out?
Sure. Thank you so much. Thank you all for being here with us this evening, and thank you for everything you do with your health ministries. And I specifically work on if you have any tobacco initiatives or initiatives where you're trying to address or respond to the opioid crisis, I would be your contact person for that. So I can do workshops around any kind of tobacco education, whether that be vaping with your youth or tobacco with adults. And also I can do a workshop on how your congregation can respond to the opioid crisis. What are some compassionate, helpful ways that you can respond to that in your community? But again, thank you so much for being here. And as we think about our health ministries, and as we go through Lent, I wanted to share a quote with you from Pope Francis that I kind of find helpful, but especially as we're thinking about these things. So Lent comes providentially to awaken us, to shake us from our lethargy. So I just wanted to leave those words with you, and wish everyone a good evening, and peace be with you all.